Welcome back to the Informed Pregnancy and Parenting podcast. Today we are talking about stem cells and in particular bone marrow with my co-host Angelica Ortiz and our guest Leah Krief. So Leah was talking about your husband Adam, and this has all just been over the past few months. It's amazing. It sounds like sometimes you're able to talk about it like it was back in the day.
Yeah.
You know, but it's happening now. It's like real for you today. Adam needs a bone marrow transplant to save his life. And the Bone Marrow Registry, international registry with just 24 million people on it, did not turn up one match of a girl in Germany who declined to donate. So you guys sort of took matters into your own hand. I have a quick question about cord blood. Did you bank cord blood with any of your babies?
Unfortunately, no.
You did not.
And I also wasn't informed of the opportunity to donate the cord blood, which, again, was never presented to me at the time. But if there's someone who decides to not bank their own children's cord blood, please consider donating it.
Donating it to a public registry
Yes.
also, right? Would cord blood have helped you?
So I believed that there were 8 units of cord blood that would be necessary for an adult transplant. However, given the specifics of Adam's cancer and the unique and aggressive nature, they said that the chance of recovery was really higher in finding a well-matched donor.
So there's a potential, but it's the inferior method.
Correct.
So if you can find a donor, that will be the way to go. So you guys took matters into your own hands.
Yes.
Right? There is hope for Adam,
Yes.
which is, I mean, I know it as a hashtag, but talk a little bit about hope for Adam.
Sure. It really started with Adam wanting to share a little bit of his journey with friends and family, just letting them know. I think sometimes when you think of cancer, you think of, someone's great aunt or a grandmother that passes, which is tragic, but not always something that you necessarily relate to on a it could be me kind of level. And so what started as a few pictures on Facebook or Instagram really turned into what feels like a movement.
Well, it's definitely a movement.
Yeah, I hope so. It really was about some friends coming together who said, let's make this something. And a cousin of mine also who encouraged us to put together a video and to sort of appeal to the masses and say, it's so easy to get on the registry. It's really simple. I also think that our goal was to really educate people on stem cell donation and what that looks like, because people really have a foregone notion to some degree of what stem cell donation is.
Yeah, right. I mean, when I was in college, back in the day, when I was in college, if you wanted to donate, not to register, but to donate, they told you when you registered, you're going to be out of work for a while. It's kind of an intense harvesting process. They have to dig into your big bones and draw out the bone marrow.
Right.
It was sort of daunting, especially for somebody that you don't know.
Sure.
Anybody in the world could just turn up as a match, and you'd have to go through, either make the decision to do it or not to do it.
Yeah.
And both of them could have been really daunting decisions. Only through meeting you and this process did I find out that the procedure to register yourself could not be simpler.
That's true.
And then if you become a match, at least in Adam's case, the procedure to donate is actually not that big a deal.
Yeah.
So let's talk about those two. How does somebody register for the International Bone Marrow Registry?
Well, there are a couple of different registries. We've worked really closely with Gift of Life, and that's giftoflife.org. It's as simple as going online, filling out a form, and they will send you a free swabbing kit. And basically what it looks like is you open up this kit, and there are 4 very long cotton swabs in there. And you
So like a Q-tip.
Yeah, yeah. One-sided.
One-sided Q-tip.
Yes. And so basically what you're doing is you are sort of rubbing it against the 4 corners of your mouth, sort of trying to get some cheek cells on there. And so some countries will do saliva. So, for example, in the UK, all you have to do is spit inside the tube.
Thing,
yeah, give
done.
a spit is like one of the big hashtags over
That's
there.
how they,
Give
Give
a
a
spit.
spit.
Yeah.
oh, give a spit.
Yeah. And here, it's cheek cells. And so you
Equally simple.
Totally.
I mean, not a big deal.
Yeah, and you put those back inside the envelope, and postage is already paid for, and you send it in, and you have just there the potential to be someone's superhero.
You pay nothing.
Right.
Nothing.
In less than a 5-minute process.
Totally.
I've done
Not
it before.
even. Yeah.
it's
It's
so
so
fast.
quick.
Yeah.
It hurts more when I brush my teeth.
There you go.
Seriously.
Or floss.
Wait, so, or floss. Floss is painful. Let's not go there. So that's how you register. And then all the registries are connected. You talked about this particular.
Yeah. All the registries that we've worked with come together in what's called the Worldwide Registry. And so just because you are, living in the United States and a California, Los Angeles resident and whatnot, you could be matched up with, in Adam's case, a young girl living in Germany. It's really an incredible web network of people wanting to in most cases help other people.
So it couldn't be easier to register.
Mm-hmm.
But then once you register, like this girl in Germany, you can get a
Yes.
call. On the one hand, you could get a call and say you have an opportunity to save somebody's life. On the other hand, you may not be able to. So what's involved? What would it be? If I was a match for Adam, what would my side of the process be like?
So what would happen is you'd come in for a second round of testing. I actually, in my freshman year of college, registered to become part of the registry, thinking, it's this great thing. Of course, I want to register. My mom is a kidney transplant recipient. I love the idea of being a donor. Let's do this. And I actually got a call later in grad school that I was a match for a middle-aged gentleman. And they asked if I was interested, and I said yes. And about a week later, they scheduled me to come into some, small lab to get blood work done. And I wasn't picked because I guess I wasn't a good enough match, a close enough match.
What's the second round of testing involve?
Just a blood test. You fill up, I think it was something like 3 vials, like little vials.
No big deal.
And then they then examine that, look at your HLA typing again, look to see if you have any sort of anything wrong with you, I guess. And they ask you a series of questions. How willing would you be to go through the donation process? How willing would you be to, possibly move your schedule around? When would your earliest availability be? And then something to consider that's really important is I had mentioned before that sometimes people have this foregone notion of what stem cell donation looks like. In someone like Adam's case, stem cell donation is not this process by which someone is scooping, bits
Bone
out,
marrow.
Right.
bits out of your spine.
Right.
A lot of people had this notion that they dig into your spine to extract marrow.
Because it was, I think, at some point.
Well,
That's
I don't know what
thing.
what
Into
it was way back
hip
then,
bones,
but
yeah.
it is hip bone. And in 80% of cases, or 80+% of cases at this point, stem cell donation is simply a process of apheresis, blood donation. And so it's sort of like a fancy blood donation. What happens is once you agree and you have decided that you want to do this for somebody else, you get a series of 5 injections into your arm. And what these injections do is they sort of put your bone marrow into overdrive so that you're creating an abundance of stem cells. Around day 4, you start to feel a little bit achy. Someone had,
Is it the same thing you were talking about with Adam, where there's so much?
oh no,
No.
no, that's like intense bone pain.
No, I'm not saying to that degree, but I'm
Oh.
saying what causes the achiness? Is it just that
A
you have
fullness.
Yeah, a fullness
So
inside
they
your
said it was
bones.
something like flu-like symptoms, like that, where you
Okay.
start to get a little bit achy.
Yeah.
So that's what they sort of said it mimics. And so you start to feel it on day 4. And then on day 5 is your donation day. So the second you get hooked up to the machine, all those symptoms dissipate and you're feeling back to yourself.
This is basically 2 IVs.
Yes.
One in
so,
one arm,
Exactly.
one in the other arm.
And so what happens is blood is extracted from one IV, and then it goes through this apheresis machine. And what it does is that sort of filters out the stem cells from the blood. So it will separate the stem cells and keep those, and then put the blood back into your body through the other IV in your other arm. And then the body takes about 4 to 6 weeks to regenerate the stem cells that it's donated. So there's no love loss with your own body.
It's stem cells that are coming out?
Correct. Blood coming out, stem cells being filtered out of that blood coming back, being put back in, and then those stem cells are regenerated naturally within the body.
So your bone, but it's coming from your bone marrow.
Well, what happens is that these injections that they're giving you that encourage your abundance of stem cell production, what happens is they start coming and floating around in your peripheral blood because there are just so many.
There's so much.
So they don't have to go
But it's
into
coming from your bone marrow.
Correct.
But it's spilling out into your regular bloodstream. And this machine just filters them out.
Yes.
And then you're good. And you stop taking the medication, you stop overproducing
Correct.
stem cells.
Yes. And if you are explained that you're going to have the process be, because you are then asked, because there are certain situations, certain diagnoses for which the older method, the method of going through the hip bone, is still preferred. And those are for populations, the pediatric population. It's still the preferred method of extraction.
What's the difference?
For pediatrics?
Yeah. Like, what's the difference of harvesting it directly from the hip versus spilling them out into the periphery?
You know, I
put you on the spot.
Yeah, but that's okay. That's okay. It's something worth looking into,
Yeah.
because if someone's going to ask me that, I'd like to know how to answer.
And have
because
Angelica look into it.
Yeah, because
You'll-
if
2 emails from me coming your way.
awesome. No, because I mean,
And one
if
Snapchat.
if someone's getting that call that you're going to be
match.
having your hips touched, that may be for a 2-year-old baby with leukemia, and who doesn't want to save your 2-year-old baby?
Yeah, but I also imagine that even when they go into your hips to get it, it's probably a better operation than it used to be.
Oh, very much so. I mean, you're put under. You're literally treated like a superhero because you are, and
I wonder how many people have donated over the
that
years.
way.
Yeah.
So many of the people that I've spoken to at this stage in the game are really those who've donated through the process, which Adam is, needing. But it'd be definitely worth looking into and reading about.
So, through Hope for Adam, you drew a lot of attention to the registry,
Yeah.
the International Registry, and you actively worked to sign people up.
Yes, we did.
Do you know how many people signed up through your efforts?
A little over 60,000.
Wow, which, I mean, percentage-wise over the entire registry, that's a significant number.
It's pretty gigantic. I mean, we have, we like to call them Adam's Army.
Wow.
We have, there are people who, there was a girl whose parents moved here for about a year in elementary school. I haven't had contact with her then since. And she helped to register something like 200 of her students overseas.
Wow.
People really came together. We had friends of friends who reached out to celebrities.
I saw some online, big celebrities posting about it online.
It's pretty incredible, the pull these celebrities have. When their hearts are big, the response is gigantic. I was telling you guys earlier that Kim Kardashian had, tweeted about Adam and posted a picture, and just her words alone and her sharing Adam's story alone resulted in an overnight, registering of 5,500 new potential marrow donors. It's incredible. It's incredible.
I got to tell you, because I have a movie about breech babies, a documentary called Heads Up, and every day there's a couple of dozen pings to the website. And one night, Kim Kardashian also tweeted about it. She blogged about it. And then our website it was Thanksgiving. It was also
She's amazing.
just about here. The whole website got so much traffic. There were stories about it, and there were magazine articles about it. And, once that momentum started, it kind of fizzled down a bit. But once that momentum started, we actually got so much audience that we were able to make a change. We were able to, here in Los Angeles, start to get multiple hospitals on board with doing more breech births in a safe way. And now there are more choices than there were before she did that. And one of the hospitals is teaching residents how to do it so that younger doctors can learn there'll be a future. And like you said, it's all from one person and choosing to say, hey, we can make a difference here, and publicizing for you.
Yeah.
60,000 is incredible.
Yeah, congratulations.
And I know
Thank
that
you.
you, through those efforts, found matches for other people.
Yeah, we know of 3. One who's been transplanted already.
Wow.
There are more on the way, more kits being sent out. And this is also a system by which things sometimes take a few weeks to get processed. So, we're hoping to hear so many more people who've been helped as a result of our efforts and the efforts of Adam's Army. I guess.
I mean, I'd love to encourage all of our listeners to just think about what's involved in testing, what's involved in donating, should you be selected. And if it sounds reasonable to you, then not just to go ahead and do the test, which takes 2 minutes and no money at all, but to also share, this podcast, which is super informative, and also just information. Hope for Adam. We can find you on Facebook.
Yeah, on Facebook and on Instagram
and Hope the number 4.
Yeah, Hope the number 4 Adam.
Who can't donate?
People with autoimmune disorders. Things like people who are diabetic, people who suffer from Crohn's disease, people who've experienced cancer themselves, people with blood pressure, I think, disorders.
What about pregnancy?
So it's really funny you should ask that. Because people who are, or potential donors rather, who've had multiple pregnancies are less desirable simply because your body has gone through so many hormonal changes that introducing that into another person's system doesn't always have wonderful results.
Can you donate while you're pregnant?
No, you cannot, because you can't have those injections done while you're pregnant. You
can,
but you can definitely register while you're pregnant. We had plenty of pregnant mamas coming out registering.
But if they have multiple kids, they're undesirable.
Not necessarily across the board, because you have to understand that for some people, there may be that mama who's had 4 kids of her own who's someone's only chance.
Right.
Yeah.
That's a good point. Like, it's still, whatever you hear, I mean, it's still worth registering because, well, like now things have moved on and Adam has another match.
He has another potential to 9 out of 10 matches.
Okay.
So perhaps not as well matched as our initial 10 out of 10, but some, hopefully some really good matches.
And what's the lowest value that you can go of?
So again, that 5 out of 5, that half match.
5 out of 10.
Yeah, oh, excuse me. Yeah, that would make a full match. Those half matches may very well be the wave of the future. And again, Johns Hopkins is the leading, brain in that field, so to speak. But for Adam's case and with his team at City of Hope, they feel more comfortable moving forward with a 9 out of 10 than they would a half match at this point.
Or is there the possibility that a half match is better than a 9 out of 10?
Oh, there are some people that'll make that argument, sure.
Really?
Yes.
That's science for you.
Yes.
Science camp.
Yeah.
That's where it all starts.
Yeah.
So he has 2 9 out of 10 potentials.
Yes.
They're going for more advanced testing now?
So one is has gone through quite a bit of testing and is set for donation. But there's one who's being tested actually tomorrow. He's having his physical.
Oh, wow.
Yeah. And he's the more, I guess, desirable out of the two, simply because he's a little bit younger and he's male. Mm-hmm. And again, they like to have things match up as
much as possible.
Closely as possible, yeah.
Are they here, local?
One is currently living in the U.S., not born in the U.S., and the other one is also in Germany.
Oh, wow.
Yeah.
Because they have a big registry.
Yeah, they do.
So internationally, it's the same process. They don't have to come here.
No,
right?
They
get the medications there. They do the removal there.
Some countries' systems line up exactly with the U.S.'s. And for example, Germany's system lines up exactly with the U.S.'s. However, in countries, I believe, like France, things are a little bit different. Also, even getting on the registry in countries like France or in Mexico, both are which things that we've tapped into, actually use a method of blood draws for registering participants or potential donors.
Blood draw just to register?
Mm-hmm. And for that reason, they have much smaller, significantly smaller registries.
Are they able, just out of curiosity, are they able to send a kit here from Mexico?
So they are, but it's processing kits here is federally funded
Okay.
of U.S. citizens.
Oh, only of U.S. citizens.
Yes. So abroad, for example, in other countries, kits have to be paid for.
Got it.
I know that we did a gigantic drive overseas, and everything, any kit above 5,000, we had to pay for out
How
of
much is a
pocket.
kit?
It ranges anywhere, depending on the country, from $45 to about $60.
Wow.
Yeah.
It's not. It's
It's
that's
not.
an expensive kit.
Yes.
Yeah.
Yes.
I get mine at Target. They're not even a sponsor, and I said that. Wow. So it can really add up. But
Yes.
for an individual, that might be doable. But I was just thinking, like, if you want to start a drive in Mexico to build up, because each population has unique blood typing.
Yeah. We paid for those drives.
You paid for those.
Yeah,
drives
we did one in
over
Mexico,
5,000.
and we did one in Paris, actually, as well.
Wow. Well, I feel like, it's sort of exciting, I guess, cautious optimism
Totally.
right now.
Yeah.
With-
And Adam seems very optimistic also, and it's great.
That's one of his gifts. I mean, the sun rises and shines every day for him, so that's really a gift that he has.
Yeah, and City of Hope is not that close to here,
Right.
the hospital where he is.
Mm-hmm.
And you've got 3 little kids,
Yeah.
and you work. Are you still working?
I work twice a week. I'm a speech therapist at a preschool. And so,
You speak very well.
thank you.
Yeah.
I appreciate that. I sort of kept that going. I definitely minimized my caseload and things like that in the time that I was working, but I really love what I do, and I feel like it helps keep me moving forward.
Just a little structure
Yeah.
for you. How are the kids?
I'd say that the baby has no idea.
Right. Currently 10 months
Yeah.
old, and this has been going on since.
Since he was about 5 months old.
Right.
I'd say my 2-year-old has become increasingly aware in ways that I am surprised. On Thursday, I'd planned to surprise Adam at the hospital with the 2 older kids, with Lev and Joel. And I didn't want to tell them beforehand up until we were, leaving the door and we've gotten the okay, just in case something had changed. And so I said to Joel, who's 2 years old, I said, we're going to go visit your daddy. And he was so excited. And my mom, who's been staying with us to help, he called her into the room and he said, we're going to get my daddy. We're going to get my daddy. And I had to explain to him that we're going to visit daddy, but we're not going to get him. We're not going to bring him home. So that was hard. And then my 4-year-old, who is frighteningly precocious, she's having a really hard time. She's having a really hard time.
That's understandable.
Yeah.
Well, hopefully there'll be a big homecoming soon.
Yeah.
Yeah.
Helen will be strong, and I know that your work in this field will never stop. And you're just, I really thank you for being here today, because I know it's hard to share and talk so personal about something so strong and intense that you're going through, that you're living through right now. But in my conversations with you in the past few weeks, it just really opened my eyes a lot. Like you said, it's never something you expect that could even potentially happen to you or someone you love or care about. I sort of feel like when I watch Breaking Bad, I'm like, oh, I feel bad for that guy. But it would only ever be that guy.
Yeah.
And it could be any of us at any time. And so I really appreciate how you opened my eyes and my heart. And I really know that the effort that you've made and the work that you're doing in saving other people's lives along the way,
Yeah.
those merits are going to come back to you. And I just can't wait to have Adam come sit on the podcast and tell us how strong he's feeling and see you on the other side of that.
Thank you.
We will have show notes. I know we covered a lot of information.
Yeah.
And I want to put links to the Hope for Adam and links for the different registries where you can reach out and get a kit sent to your house, and maybe some more information about what it's like to donate. And what we are going to also do is come back for another episode on stem cells, specifically related to cord blood. And I know that there's lots of questions about what is cord blood and how is it that you bank cord blood or tissue, and what's involved in private banking and what's involved in public banking. So we're going to come back with some experts and talk about that. I want to thank Leah for being here and Angelica for co-hosting today. You've been listening to the Informed Pregnancy podcast. You can feel free to visit informedpregnancy.com, and your questions and comments are always welcome via email to info@informedpregnancy.com.